Welcome to the GoalZero Toolbox Talk series. Today's Toolbox Talk: Drug Abuse Canada. According to the Canadian Mental Health Association, Ontario, an estimated 21% of Canadians will meet the threshold for substance addiction during their lifetime. Showing employees how to recognize and report the signs of impairment in the workplace and giving them the confidence to ask for help with substance use is crucial to reducing the risk of injuries and even fatalities for themselves and fellow workers. Stress, fatigue, and injuries are some of the most common factors leading to substance use in the workplace. Other factors that can play a role include repetitive duties, isolation, lack of opportunity to advance, high demand and low control over work, and long hours or irregular shifts. Cannabis and opioids are among the substances most frequently used in the workplace. Opioids are prescribed to manage pain, including pain from injuries sustained at work. However, opioids can cause euphoria, the feeling of being high, which increases the potential for the drugs to be used improperly. The short-term side effects of opioids include drowsiness, nausea, vomiting, euphoria, difficulty breathing, headaches, dizziness, and confusion. These effects may cause impairment and affect the ability to do jobs safely. People working in construction, healthcare, and other physically demanding jobs experience a higher rate of injuries that often require pain management. This situation can leave workers vulnerable to dependence on opioids. An impaired person's judgment, alertness, depth perception, and emotional state may impact their ability to work safely or make safety-sensitive decisions. The after-effects of substance use, such as hangovers, withdrawal, depression, or absenteeism, can also affect job performance. Intervention is required if the employee is unable to perform their job safely or if their judgment or cognitive ability is impacted. It isn't the role of a supervisor or manager to diagnose substance use or addiction, only to recognize impairment and respond according to the organization's policies. These steps may involve speaking to the employee in a private area to discuss their behavior with one witness present, emphasizing that the concern is about safety for others and themselves, and inviting the employee to explain what's going on. Based on the employee's response, discuss the available options, and follow the steps outlined in your organization's program. State your concerns in an unbiased and factual manner. Do not place blame or make assumptions. Be clear that the intent is to maintain a safe working environment and that the organization is concerned for their well-being. Try to anticipate the employee's reaction so that you can be prepared. Identify any consequences if the issue continues and what steps must be taken. It may be necessary to assign non-safety sensitive work or to ask the employee to stop working. Arrange for a safe ride home. Do not let an impaired employee drive. And if applicable, notify senior management or a union representative. To encourage early treatment and reduce safety risks, assure workers that they won't be stigmatized and that their livelihood isn't at risk if they ask for help. Promote the availability of confidential employee assistance programs, EAPs, to encourage workers to seek help for substance use issues. Foster ongoing conversations on substance use and involve employees in the development of workplace policies. That way, they know they can expect consistency with how substance use is addressed, giving them added confidence to seek help for themselves or their coworkers. A great place to start policy discussions is defining substance use and impairment. Employees need to know how to recognize impairment, when to come forward, whom to report their concerns to, and what their rights to confidentiality are when they do come forward about themselves or their colleagues. Make sure workers and supervisors are familiar with the available training and educational resources on topics such as prevention and resilience and fighting stigma. Also, let them know about any assistance available to workers struggling with substance use, and how use and impairment will be addressed in the workplace.